Thank you, Mr. Chairman. Temporary high-risk pools in Montana, I understand you've been in contact with our auditor already about it, but I noticed in the appropriations, $5 billion was taken out of the general fund to pay for the high-risk pools around the country, but CMS is suggesting that the money will run out in 2011 and 12, and of course they don't have to be in place until 2014. Why the shortfall? Why the anticipated shortfall, and are there other areas that you see it's already coming in over budget?
Congressman, we don't know exactly how many people will be able to be enrolled in the high-risk pool. A lot of states offer high-risk pools right now. I think Montana's
Which is one of the reasons we wondered why we did this in the first place. If we already had the high-risk pool in place, why supplant it with something created by the federal government to do something that was already in place?
This is a totally voluntary program, first of all. Secondly, it won't be created by the federal government. If Montana chooses to set up what is a parallel pool, the money that is allocated in the Affordable Care Act is to subsidize rates so they don't rise above 100%. In Montana, they're well over 100% of the market right now, and it makes it very unaffordable for lots of folks.
But my question is, you asked for $5 billion, you got $5 billion, and CMS is already anticipating it will not last through 2011 or 12, and the high-risk pools are not to be in place by 2014. A shortage, a shortfall, an over-expenditure. How are you going to deal with it? Are you going to limit access?
Again, sir, this is not a federal program. It will be, if Montana chooses to participate, they will have an allocated set of resources which help subsidize care for Montanans who currently are uninsured and uninsurable.
Madam Secretary,
if they choose not to participate, that's a choice that the state will make.
Let's go back to the question. The question was, the legislation created high-risk pools, or the opportunity to create a high-risk pool.
That's correct.
By 2014.
No, sir. Right now, this is the bridge strategy to a new market.
Correct.
In 2014, not in 2014.
That is correct. But by 2014, a alternative structure needs to be in place.
The exchanges.
Correct. But if the exchanges are in place in 2014, but you're using Montana and the other states' temporary pool, and if you appropriated $5 billion and it's not going to make it to 2014, you're going to have to come back to this Appropriations Committee and ask for more money. You've already anticipated that it's going to cost more than you told us it was going to in asking that the legislation be passed in the first place.
Sir, currently the federal government pays a fraction of a state's high-risk pool. It puts about $50 million into an overall plan. This is an attempt to provide a safety net coverage if the money actually is going to have a shortfall.
Madam Secretary, with all due respect, that doesn't answer the question of the shortfall. I understand the bridge. I understand that you're going to cooperate or participate or help the states, but you said it was going to cost $5 billion, your anticipated expenditure, and it's not.
Well, we don't know what it's going to cost, and I would
So you disagree
no
with
one
CMS?
does, because we don't even know how many states want to participate in the program at this point. We put out a letter to governors. I talked to my former colleagues yesterday. We will, by April 30th, have some idea. I mean, we really don't know at this point, sir.
Okay, the second line of question I'd like to go down the path. In the stimulus package, the law certainly says you can't lobby.
Right.
You know, the bastion of information from CNN. State of New York, obesity, educate leaders and decision makers about trans fat. This is a $3 million grant award. Santa Clara, California, advocating for an increased statewide tobacco tax. City of Chicago, tax increase at the city, county, and state levels. Iowa Department of Public Health, $3.3 million. Inform local policy makers about evidence and practice-based pricing. That sounds like lobbying.
Congressman, I read the same information from the same news source. I can assure you that we have, we will follow to the letter of the law, the federal law, which prohibits federal funds and has, not just in the Recovery Act, but consistently prohibited lobbying with federal dollars. We will track that very carefully. We've already notified a whole host of folks that is the law of the land. That was part of the grant application. It will continue to be part of the monitoring. Federal funds will not be used for lobbying.
Okay, because those are all quotes from the grant application in the first place.
A lot of the applicants have a whole host of strategies that they employ and have employed historically, will continue to employ. We are funding programs that are not lobbying programs. They are actual prevention.
But your oversight
wellness.
missed it in the initial grant application.
Pardon me?
Your oversight missed it in the initial grant application. The grant application had those exact quotes in it.
They have been notified that there is an absolute prohibition for using any federal funding for lobbying, and we will follow up on that very carefully.
Thank you.
Thank you.
Thank you, Mr. Chairman.